Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by three expert otolaryngologists and ENT physicians, Dr. Stanley Chia from MedStar Washington Hospital Center, Dr. Mark Russo, and Dr. Jonathan Giurintano from MedStar Georgetown University Hospital. Today, we're discussing sleep apnea. We'll talk about symptoms and treatment options, in particular, an innovative treatment option, which is the Inspire Sleep Apnea Implant. So do you want to get your sleep and your life back on track? Then you're in the right place. These experts work with patients to provide the best medical and surgical care to control symptoms, prevent complications, and achieve the best quality of life. So stick around, give us a like, let us know that you're watching, and share this broadcast with your friends. We're also taking your questions, so please ask them in the comments and we'll answer them during the broadcast. So thank you all for joining us. Really appreciate the time. Before we begin our discussion, let's get to know our experts. Let's start first with Dr. Chia. Dr. Chia, can you tell our viewers a little bit about yourself and your expertise?
Sure. Good afternoon, everybody. My name is Stan Chia. I am the chair for the ENT department at MedStar Washington Hospital Center, and I've been the chair here for about 5 years. I also serve as the medical director for perioperative services at the Washington Hospital Center. Sleep apnea is a pretty large portion of my practice here at the hospital center. We are going to be talking a lot about Inspire, and I was actually on the FDA board that approved the device, and I've done about roughly 100 procedures or so at this point.
Wonderful. Thank you. Dr. Russo, can you tell our viewers a little bit about yourself and your expertise?
For sure. My name's Mark Russo. I practice out of our MedStar Lafayette location, which is downtown at 21st and L Street. And I'm probably the youngest doctor on this group. I trained under Dr. Chia, and I've been doing Inspire implants over here, and as well as general ENT care.
All right, thank you. And Dr. Giurintano, can you tell us a little bit about yourself and your expertise?
Of course. So my name is Jonathan Giurintano, and I'm a board certified otolaryngologist, and I'm a fellowship trained head and neck surgeon, and I see patients at both Georgetown University Hospital as well as Washington Hospital Center. So as a fellowship trained head and neck surgeon, my expertise consists of caring for patients who have both benign and malignant diseases and disorders of the head and neck, as well as salivary and endocrine tumors. And I also have a focus on advanced reconstructive techniques for head and neck defects. So the head and neck is exclusively where I work. So the Inspire procedure fits right into my practice as the neck is where I am on a daily basis.
Wonderful. Well, thank you. We really appreciate you all joining us. Let's get into some questions. Let's just start generally. Dr. Russo, can you tell our viewers what is sleep apnea?
So sleep apnea is a medical condition where you slow or stop your breathing while you sleep. So overnight, that presents often as snoring and pauses in your breathing while you're sleeping. And it either comes from a central cause where the brain just kind of stops sending the signal to be breathing while you sleep, or from an obstructive cause, which is the much more common version of it, where the tissues of the head and neck kind of collapse backwards and block the breathing while you sleep.
Okay, thank you. So you talked a little bit about in that description about some symptoms. Any other signs or symptoms of sleep apnea that you want to share with our viewers?
Yeah, so one of the things that a lot of my patients are coming in for is often for snoring. That's one of the symptoms of that obstructive air pathway. But the much more typical symptom, the much more telltale one, is actually that you feel overly tired throughout the day, almost like you can't get a good night's sleep, and that's because the sleep gets disrupted by those periods of time that you're pausing or stopping your breathing while you sleep. So daytime tiredness, and then sometimes waking up in the morning with a bad headache first thing can be a sign that you weren't getting very restful sleep overnight and you weren't getting the oxygen that you needed while you sleep.
Okay, thank you. Dr. Giurintano, who typically suffers from sleep apnea?
So anybody is really at risk for sleep apnea, but we know that the most common subset of the population that we see that suffers from sleep apnea tends to be older males, though it can also affect females as well as children. In North America, it's estimated that the prevalence of sleep apnea is between 15 to 30% in males and 10 to 15% in females. With regard to the adult population, it's typically loss of pharyngeal tone, so loss of the muscle tone in the throat and the areas that help to keep the airway open when you sleep. That is often the triggering factor for obstructive sleep apnea. Where in children, it's typically more commonly due to enlargement of the adenoid or tonsillar tissues.
Okay, thank you very much. So let's talk about treatment for this. Dr. Chia, what are the current treatment options for sleep apnea?
Sure. So I would probably start out just by saying that seeking treatment for sleep apnea, especially if you have moderate or severe sleep apnea, is very important. And the reason why is because if you have untreated sleep apnea over a long period of time, there can be some pretty serious consequences. So in addition to just being tired all the time, untreated obstructive sleep apnea has been very closely linked to heart failure, heart disease, strokes, arrhythmias, so some pretty serious consequences, in addition to increased mortality, frankly, as you get older. So treatment is extremely important. The first line treatment, and what's still considered to be the gold standard for treatment of obstructive sleep apnea, is continuous positive airway pressure, or CPAP. So this is a mask that fits either over the nose or in the nostrils or over the entire face, and it pushes air down into the airway. So as Dr. Russo mentioned, obstructive sleep apnea occurs when the tissues of the throat collapse and it prevents you from breathing. And the CPAP mask acts as a way to keep the airways open just by blowing air into the airway. So that is the first line treatment for almost everybody that has clinically significant sleep apnea. Now, the problem with this is, many of our viewers may encounter, is that a lot of people can't tolerate this mask. And it's up to 50% of people that try to use this mask find that they actually can't. And there's various reasons for why they can't. So it could be things like claustrophobia, or they can feel like there's too much liquid, or they feel like there's breathing into a wind tunnel all night. And a lot of people end up just ripping the mask off at night, or they're feeling like they just can't sleep with the mask on. So, up to half the people are really unable to use this mask. So there are some alternatives to the sleep apnea that are available. One of these, the alternatives to the CPAP mask that are available. One of these is an oral appliance, which is something that the dentist can make to fit over the upper and lower teeth. And it pulls the lower jaw forward. And by pulling the lower jaw forward, it also pulls the tongue forward and also tenses the muscles in the throat to prevent it from collapsing. And that's actually a really good option for a lot of people that can't wear the mask because it's easier to tolerate. It's not as big and bulky. It doesn't make a lot of noise. So it does tend to work well for a lot of people. However, it's best for people that have mild to moderate sleep apnea, and doesn't work as well for severe sleep apnea. It can also be fairly expensive. So the out-of-pocket cost sometimes can range, up to a couple $1,000s, depending on who you go to and what your insurance covers. So that it may not be an ideal option for everybody. Then you're looking at possible surgical options to manage the sleep apnea if either the CPAP or the oral appliance don't work for you. Probably the oldest and most traditional sleep apnea surgery that's out there is something called a uvulopalatal pharyngoplasty, or UP3 as it's more commonly known. And this is a procedure where you take out the tonsils and you shave the palate. You can also do procedures to remove tissue from the back of the tongue. The procedures are extremely painful, like some of the most painful surgeries that we do, even bigger and more painful than some of these cancer surgeries that Dr. Giurintano does all the time. And the success rates aren't always as high as we want them to be. So the combination of pain and the lower success rates make this not an ideal operation for a lot of people. There are some people that it works for, but a lot of them, it's not ideal. There's another procedure that the oral surgeons do where they can advance the upper lower jaw forward and hold it in place with plates and screws. That's also a big procedure, but it's not a very painful procedure. The benefit of this surgery is that the success rates are extremely high, so almost 90%. The downside is it is a large procedure, and it also has the possibility that it might change the way that your face looks. So you can imagine that if you're pulling the jaw forward and holding it in place, that you might have an alteration in your appearance. It's generally not a huge change, but that's somewhat of a turnoff for a lot of people. And the recovery process for that can actually be fairly long. And then there's a lot of other surgeries that I won't get into because I don't think they work all that well. But then the one that we're here to talk about today primarily is the Inspire hypoglossal nerve stimulator, which I think is really a great option for a lot of people. And I'll let Dr. Russo describe that in more detail.
Okay, great. Well, thank you so much for getting into those treatment options and talking through some of the challenges that people have with the traditional approaches like the CPAP. I have heard personally, it's not always just the patient that has struggles with the CPAP, but their partner who they're sleeping next to also has challenges with the CPAP, it being loud and whatnot. So I'm glad to hear that there's some alternatives that are available. So before we talk about the Inspire Sleep Apnea Implant, I do want to welcome any viewers who just joined us. Thank you so much for joining today. We are here talking about sleep apnea. We've talked about the signs and symptoms, who suffers from sleep apnea, and some of the treatment options. We're going to get into the Inspire Sleep Apnea Implant next. But if you haven't already, ask your questions, give us a like, let us know you're watching, share this broadcast with your friends. We have our experts here from MedStar Washington Hospital Center and MedStar Georgetown University Hospital talking about this important topic. So let's get into questions about the Inspire Sleep Apnea Implant. Dr. Russo, what is it and what are the benefits? You're on mute.
Thank you.
No problem.
The Inspire implant is a surgically implanted device that does a lot of the things that Dr. Chia was talking about to help open up the airway while you sleep. It has two components. One is a sensing lead that tells when you're breathing in and out as you sleep. Then there's a second lead that goes up to the tongue in the neck so that when you take a breath in, it tenses the tongue and helps push it forward so that the back of the mouth opens up and it removes that level of obstruction as you sleep. This has a significant benefit. Patients that get this have a cure rate up to 90% in the initial study. So it is a highly effective surgery, unlike the challenges that Dr. Chia was talking about with some of our other surgical options that exist out there.
Mm-hmm. Thank you very much. So that's one of the benefits. Why should someone choose this as a treatment option? And is it a choice or is it a conversation that you have with your physician on what the best option is for you?
I mean, of course, it should definitely. I mean, all these things. You shouldn't be going into any surgery without a conversation about yep. The risks and benefits with your surgeon. But the patients that do the best with this are those that have really tried and struggled with the CPAP machine and really have kind of exhausted their ability to be able to use it or to be able to tolerate it. And as Dr. Chia was saying, that's a solid 50% or can be up to 50% of patients that are starting up with CPAP.
Okay. Wow. Let's talk about how long the Inspire implant has been around. Dr. Giurintano, how long has this been available and is it safe?
Yeah, so it's a great question. The Inspire device actually was first started to be implanted into patients as part of a trial called the STAR trial. It's STAR. Which was a multi-institutional study in which patients were receiving the Inspire implant, which was new at that time. And the change in the severity of their sleep apnea was being measured to verify that it was helping patients with sleep apnea. And the STAR trial started enrolling patients in 2010. And then they published their results in the New England Journal of Medicine in 2014. So the STAR trial was really the landmark study that verified that the Inspire device was an appropriate tool to help in sleep apnea for patients who were unable to tolerate CPAP therapy. And the Inspire device itself received approval from the FDA in 2014 following the STAR trial. And since then, with each year that's passed, it's just becoming more and more widely accepted as an option for sleep apnea management, and is becoming more widely implanted. It is a very safe device. The side effect profile is not much different than many of the other head and neck surgeries we do for sleep apnea and for other head and neck disorders. And patients tend to have a very good experience, with over 91% of patients demonstrating satisfaction with the device once it's implanted.
That is great. Who is best suited for the Inspire implant, and does it work for everyone?
So not everyone meets candidacy for the Inspire implant, and that's a good thing for patients to know. But we do have a very good understanding of what type of sleep apnea patient will best benefit from the Inspire, and who really meets the criteria for the Inspire candidacy. So first, you must be an adult. You must be greater than 18 years of age to be a candidate for the Inspire at this point. You must have a documented diagnosis of moderate to severe obstructive sleep apnea based on a sleep study. So this is for patients who have an AHI, or an apnea-hypopnea index, of between 15 and 65, with less than 25% of those apneas being either central or mixed apneas, like Dr. Russo mentioned. So these are really more obstructive apneas, not apneas that are coming from the brain itself. And then you have to have a documented inability to really be able to tolerate CPAP therapy. This is really an option for people who fail CPAP and have failed the first line gold standard for sleep apnea. Additionally, at this stage, patients need to have a body mass index, or a BMI, of 32 or lower to qualify for Inspire placement. The last bit of candidacy information that we must need to know is actually how a patient's particular level, a pattern of collapse at the level of the soft palate is. Most patients will have a level of collapse that's kind of an anterior to posterior pattern. And we know that patients who have an anterior to posterior collapse pattern tend to do very well with the Inspire and see a good reduction in their sleep apnea AHI and benefit the most. But about 15 to 20% of patients actually have a more concentric or circular collapse pattern at the level of the soft palate. And these patients have been shown not to benefit as much from the Inspire. And that's something that we make sure that we screen out whenever we're discussing candidacy for the device.
Okay, thank you. And does that pattern, is that something that comes out of the sleep study? Like you were mentioning the sleep study numbers earlier, that you would that, is that part of the sleep study?
So that's actually not part of the sleep study.
Okay.
It's separate. So once you kind of meet all the criteria and we decide that Inspire may be a good option for a patient, the first thing we do is actually bring patients back to either an endoscopy suite or to the operating room for a very short outpatient procedure called a drug-induced sleep endoscopy, or a DISE, where literally we simulate the environment of going to sleep, and the anesthesiologist gives some medications to kind of bring the patient to the edge of falling asleep. And then when the patient is in that initial sleep stage, we actually look through the nose with a camera to assess the collapse pattern of the palate. And that's about a 15 or 20 minute, very quick procedure that we do under some monitored anesthesia with the anesthesiologist. And that gives us the information as to whether the collapse pattern is anterior to posterior or circumferential.
Okay, that's really helpful to know. Thank you so much. Dr. Chia, what else happens after you meet the criteria, you decide that's the right solution? What is the next step? Dr. Giurintano just mentioned the endoscopy. What else happens after that?
So after it's determined that somebody is a good candidate based on all the criteria that Dr. Giurintano mentioned, the next step is to get the insurance company to provide a pre-approval for the procedure to go forward. And Dr. Russo mentioned before that it's becoming a more accepted option. Back in the days when this was a new technology, just like with a lot of new technologies, so it's a very expensive device. So the insurance companies would take up to 6 to 9 months to approve the procedure before we could proceed. And these days, it's actually much, much easier, thankfully. And that's because it's been more widely recognized how beneficial and successful this option really is. So these days, the insurance is typically taking like 1 or 2 weeks, and a lot of insurance companies will actually have a standing approval as long as you have the criteria to meet the met to be able to qualify for this, where you don't actually have to submit any paperwork. You can just proceed with scheduling. So things are definitely getting easier to be able to get this device. And hopefully we can even expand even further in the coming months as the indications are a little bit more relaxed in terms of the severity of the sleep apnea, as well as the weight range that for people that can qualify. Because a lot of people are unfortunately not candidates for this procedure at this point, but as that becomes more relaxed, which we're anticipating to happen over the next 3 to 6 to 12 months, then a lot of more people will become qualified for this procedure.
Okay, thank you. Yeah, that step is really important. So thank you for bringing that up. Dr. Russo, how long is the procedure for the implant?
So the surgery from start to finish is usually about a 2 to 3 hour procedure in total. Now this is a whole day at the operating room, so it's not like it's a quick 2 hours for the patient. There's the arriving at the hospital, meeting your anesthesia team, meeting all the nurses that are going to be helping us out. So it's a most of the day experience, but the total time under general anesthesia is usually between 2 and 3 hours. This is a same day procedure, so after recovering from the anesthesia, almost every patient goes home the same day.
Okay, that's good to know. Thank you. Dr. Giurintano, how long is the recovery after the procedure?
The total typical recovery is a few weeks. As Dr. Russo mentioned, this is usually a same-day procedure, so patients don't require a hospital visit. They're back home in their own beds that same night. And most commonly, we will counsel patients to take it easy, to not perform any strenuous activity that might require heavy lifting for at least a few weeks after surgery while all the incisions heal. We typically will place these devices on the right side of the body, and given that the device itself kind of sits over the right chest, over the right pectoralis muscle, oftentimes we'll have patients not do any really extreme movements with their right arm, kind of lifting it all the way up over their shoulder like a jumping jack type movement for at least a few weeks after surgery as everything settles down and heals. But within a few weeks, patients are back to their full normal activity. A lot of people ask about diet after surgery, and there's no restriction on what you can eat afterwards. We get people back to a regular diet essentially the next day as soon as they're ready.
Okay. Is it something you can feel in your arm or your shoulder? And I'm just trying to think about that after and the activity. You're probably feeling a little bit of soreness from the incisions, but can you also feel anything in that area?
So people feel a little bit sore. The device itself kind of sits right over the chest. So under the incision, that's where the device itself sits. And depending on a certain person's kind of level of how much adipose tissue or how much subcutaneous fat they have under the skin, it might be more palpable in some patients versus others. But the shoulder range itself is just because that muscle, the pectoralis muscle, kind of attaches up to the upper part of the humerus, the big bone in the arm. And we don't want too much of actual contraction of that muscle as things are scarring down and healing to prevent accidental displacement of the leads that sit in that area.
Makes sense. Okay, thank you very much. What about your sleep habits? How long after you get this implant do you start experiencing better sleep?
Yeah, that's the question on the top of everyone's mind is when can I turn it on and use it? So typically we'll wait 30 days from the time of surgery to have patients come back and meet with their sleep physician to actually turn on the Inspire device. And the device itself has a small remote that's handheld that you can dial up the level of intensity of the stimulation of the hypoglossal nerve. So we kind of titrate that up and you work hand in hand with your sleep physician to dial in the appropriate level of how much stimulation of the nerve gives you that benefit to open your airway up at the right level. So usually for most patients, it's within about 6 to 8 weeks that the level gets dialed up to where they like it to be. And they start really getting that good, restful, relaxing sleep.
That is great. Thank you so much. What about side effects? Dr. Chia, are there any side effects or risks of getting this implant?
Sure. Well, getting back to one of your questions before, though, you asked if you could feel it on the chest.
Yeah.
I have a little like a model of
Oh,
what
perfect.
here, so
Okay.
a little bit blurry, but it's a little bit close to the screen, but it's about this size, and the width is very narrow. So I mean, it's basically like a pacemaker.
Right.
So as the technology continues to improve, it's going to continue to get thinner. So you can feel something if you push against the chest, but if you were to look at somebody, then it wouldn't be obviously noticeable that there's something there. There might be some slight like fullness in that area. So it's not that prominent or noticeable at all. And the incisions heal up really nicely. In terms of the risks and side effects, so there's risks with any surgery. So this is a lot of people that come to see me are actually surprised that this is a surgery. So they think that this is just something that they can put on the outside and it works. And when I tell them that this is actually a surgery, they're somewhat surprised. So that's the first thing for people to know when they get into this. And it's actually not a minimally invasive surgery either. So each of these incisions that are made are about like 5 centimeters in the chest, and I make about a 4 centimeter incision in the neck. But the side effects and the recovery are, not that bad at all. The potential risks of surgery would be things like the usual like bleeding or infection that you could have with any type of surgery. There's also a small chance of nerve injury to the nerve that moves the corner of the mouth or the nerve that moves the tongue. But obviously we're trying to stimulate the tongue, and so we're focusing very hard on trying to preserve the nerve that moves the tongue. So like I personally have never had any injury of that nerve in the past. There's also a small, very small chance of a lung collapse. It's called a pneumothorax, because we're actually inserting that sensing lead in the chest between the ribs. It's exceedingly small. I've never seen it happen, but it's theoretically possible. You can also have some discomfort of the tongue because, with the stimulation, the tongue is getting pushed forward in the mouth, and sometimes repeatedly it pushes up against the teeth, or there's like sometimes a spasm of the tongue that can occur, which, generally people either get used to over time, or we can actually change the settings with the help of the Inspire reps to be able to adjust the settings so that it's a little more comfortable for the patients. So I haven't had anybody that's had any long-term discomfort of the tongue with the use. And then there's other minor things like where the implant in the chest could potentially move around, and that can be fixed with a minor surgery. And there's a theoretical chance that it can interfere with arm movement if it's not placed in the right position. But those risks are all extremely small. So this is generally extremely well tolerated.
That's great news. Thank you so much. What about follow-up, Dr. Russo? How often should a patient follow up with their physician after the implant is placed?
Yeah, so you're following up with a couple of different people after the surgery. So I always see each surgeon's timing that they follow up with their patients is always a little bit different from person to person. I see people at 1 week, like most people do, just to make sure that those incisions are healing nicely and that things are moving along appropriately at the 1 week after the surgery. And then then they follow up with either one of our sleep doctors here at Georgetown or their own sleep doctor if we're coordinating with them to get the device activated at about 1 month after the surgery. And then I like to see my patients back at 2 months to see how things are going, making sure that everything's working out for them at that point. And then usually we plan on doing a repeat sleep study to confirm that everything's that all of the sleep apnea is gone while the device is working. Typically about 3 months after the surgery. That's a little bit variable based on how they're progressing and how much and how bad their initial sleep apnea is.
Okay, thank you very much. What type of provider would that patient see? Was it the surgeon or the primary care provider? Can you say that one more time?
It depends. You see both you see both your surgeon as well as a sleep medicine doctor. So
Gotcha.
that's typically
Okay.
on at least the ones that I work with at Georgetown are mostly pulmonary trained, although there's a variety of pathways to get to sleep medicine.
Okay, thank you very much. Just wanted to make sure I caught that. All right, we have a couple more questions that I have for you, but before I get into those, we do have some viewer questions. The first viewer question goes back to about signs and symptoms. So I'll send this one to Dr. Russo. The question is, does snoring automatically mean that someone has sleep apnea, or could you snore for other reasons?
That's a great question, and snoring is a bit more complex than just, oh, it's automatically sleep apnea. A lot of people that will have snoring, often it can just be a nasal obstruction issue. So that's often why folks are coming to the ENT side of things at the first sign of snoring, and we help tease out those other signs and symptoms to figure out if they need a sleep study.
Great, thank you so much. I have a question from Leslie. I'll send this one to Dr. Chia. You were talking about the CPAP masks and the treatment options. She is asking, what is the best mask for mouth breathers?
I will qualify this by the fact that I actually don't manage CPAP. So my understanding is that if you're strictly a mouth breather and you can't breathe well from your nose, you need a full face mask, so something that fits over the entire face. So if you have just a nasal mask, you obviously need to be able to breathe from your nose.
Okay. Thank you very much.
One thing that we can talk about there is that as ENT providers, we often help manage nasal obstruction and can often take a look in the nose and see if there's any nasal obstruction that's happening on a day-to-day basis, and sometimes talk about nasal surgery to improve that as well.
Yeah, that's a really good point that Dr. Russo made, is that sometimes the best treatment, especially if you don't qualify for one of these other surgeries, is something that we can do to help you tolerate the CPAP mask better. And we do a lot of procedures to open up the nose so that they can actually tolerate the CPAP.
Great, thank you so much. Leslie has another question. This is about the Inspire implant. She asks, what if you get the implant and then you hate it? Dr. Giurintano, do you want to take that one? And then you guys feel free, Dr. Russo, Dr. Chia, to chime in.
Yeah, we would hope that would be a very rare circumstance. There are certain times when patients have had either reactions to the implant materials or just certain physiological reasons that they could not tolerate having the implant in. And if someone had the implant placed and said, I can't live with this, there's always small procedures you can do to actually explant the device and take it out. But hopefully that's a very rare circumstance that happens. And this is a very rigorous and thorough process that we go through to counsel patients on the Inspire device and make sure that you meet criteria and really make sure that we feel it's going to provide you the absolute best benefit prior to putting someone under anesthesia and under the knife to have the Inspire implant placed.
I would just add that thankfully the success rates and the satisfaction rates are extremely high with using Inspire. Once we screen you and see that you're a good candidate, people tend to really like it. I mentioned at the beginning that I've done close to 100 procedures. I have not had to remove one yet. So the likelihood of having to explant this is extremely low.
That's wonderful. Another question from our audience is, how long does the Inspire implant last? Dr. Chia, you want to answer that?
Sure, that's actually a great question. So because the device is powered by a battery, it does have a lifespan. So the battery generally lasts about 10 to 11 years. And then after that time frame, you would just need to remove the generator. That's the piece that I showed you earlier. But the wires that go between the ribs and the one that goes up into the neck, those can stay in place. So that would just be a minor procedure where we just go through the chest, expose that generator, and then switch out the battery. But then the wires would just get plugged into the new battery.
Okay, great, thank you. Another question from our viewers talking about where the implant is. Dr. Russo, I'll ask you this question. The question is, can you get an implant if you've had a mastectomy or other type of, really it could, I guess, be any type of breast surgery. Is there concerns or challenges with that in putting the implant in?
Well, that certainly makes it a little bit more challenging in terms of the scar tissue in that area. That is something that you still can get the surgery. Same if you've had, radiation for breast cancer, for instance. Those aren't contraindications to getting the surgery itself, but it does make the surgery a little bit more complicated in that area. Likewise, we see that with a lot of patients that have certain hobbies. So for instance, backpackers, we try to adjust the site of the implants that it's not resting right where that backpack strap would be sitting. Same with hunters and people and folks like that use a gun that's going to kick back into that area. If we're concerned if it was all breast surgery done on one side, for instance, then sometimes we even talk about doing a left-sided implant, although that's fairly that's not the most common out there.
Okay, thank you very much. I have another question. I'll send this one to Dr. Giurintano, and you feel free to chime in, Dr. Chia, Dr. Russo. This question is, how will a patient's life change after they have the implant? Better sleep? I know that's life-changing, but what else?
Yeah,
what else can a patient expect?
If you talk to a lot of patients who have severe sleep apnea and they've been living with it for a very long time, and all of a sudden, whether it's CPAP or Inspire or the mandibular advancement, however they achieve it, if they improve their sleep quality at night, they say that it's like a veil coming off, like the fog lifts and they're able to think more clearly and function better. And they just have this kind of new renewed zest of life. You have more energy. Everything just tends to work better when you're actually getting that quality of sleep that you're meant to have at nighttime. So if you actually read the patient testimonials for those who've had the Inspire and have had very good results, they say it's life-changing. Dr. Chia mentioned earlier how problematic sleep apnea can be, and that it can pose a lot of grave risks to your cardiopulmonary health if present for decades and decades. The longer you deal with it, the more health risks it can pose. And we also know that it probably leads to a lot of decreased work output and work outcomes over the course of every year as well. We suspect that probably billions of dollars of revenue are lost due to people not functioning at their full capacity because of dealing with sleep apnea. So to have the ability to get back to having a normal, restful night of sleep tends to be life-changing for a lot of patients.
That inspires me. It feels life-changing. Just getting a good night's sleep is so important to a lot of aspects of your life, from your health to your mood, lots of different things. So thank you for that. I have one more question and then a comment from our viewers. One question, I'll send this one over to Dr. Chia. The question is, and we talked a little bit earlier about how the device actually works, and I think you were the one that mentioned once you turn it on, that's when things start. Can you talk about dialing up? Can you talk a little bit more about that? And the question was, can you explain the stimulation and what is actually getting stimulated?
Sure. So one thing I think that it's important to note is that the device does not sense when you stop breathing. It just senses breathing in general, because this is a common misperception. It's not like it just zaps you whenever you stop breathing. What it does is it senses every respiration. So every time that you take a breath in, it will send a little impulse to the nerve on the tongue to stimulate it to move forward and open up the airway. And the other thing that it's important to mention is that you don't keep it on all the time. So there's a little remote control that you use to activate it at night. And you just hold the remote control up to the device when you're ready to go to sleep. And you can actually set a lag time before it starts to stimulate. So I think it goes up to 45 minutes after you activate it before it can actually start to start stimulating. And that way it ensures that you're actually asleep once it starts to stimulate the tongue. You can pause it when you get up in the middle of the night. And when you get up in the morning, then you just turn it off. I do have patients that sometimes will forget to turn off the device, and generally it's not very uncomfortable, but they do say that they kind of talk like Elmer Fudd when they're trying to speak, when their tongue is sticking out of their mouth periodically with their respiration. So that can be a little bit awkward, but it's not really that uncomfortable for them. And was there another part of that question that I missed, or did I answer?
No, I think you covered it. Thank you so much. I have a comment from one of our viewers. Thank you for the comment. They're having a procedure on Tuesday. They're very excited to be able to have a solution that helps them sleep. So thank you for the additional information was the comment that we got. So thank you to all three of you for that. Thank you to our viewers for watching, that particular viewer. Good, best of luck in your procedure. So my final question to you all, and I'll start with Dr. Russo. Why should someone come to MedStar Health, particularly MedStar Georgetown University Hospital or MedStar Washington Hospital Center or the MedStar Health at Lafayette Center to get the Inspire Sleep Apnea Implant?
I mean, besides the myriad health benefits that we've talked about here, I think here at MedStar, we do a great job at kind of figuring out exactly what the best option is going to be. And like we've been talking about here, there's a lot of different options out there for sleep apnea. Sometimes it's helping you figure out a way to help tolerate the device better. Sometimes it's the hypoglossal nerve stimulator. All of these different options are there, and we will be there helping you work through all those different ideas, all those different options, and figure out what's best for you.
Great. Thank you so much. Well, that's all of our questions for today. I do want to ask you all, what takeaways should someone, when they leave this broadcast, what is the key takeaway that you want to make sure that our viewers get out of this broadcast? I'll start with Dr. Giurintano, then we'll go around.
Yeah, I think my key takeaway is if you're suffering from sleep apnea, there's not a reason to suffer. There are good treatment options out there for you, and it has so many benefits to treat untreated sleep apnea. And the Inspire is one of the options now out there that patients have. So if you are suffering from sleep apnea, take the initiative to have it treated.
Thank you. Dr. Chia.
Dr. G kind of stole mine. I would say that, like, for the longest time, so I've been doing this for 18 years now. The longest time, there was a very prevailing idea that there was no alternative to CPAP that was really out there that was effective. And a lot of the sleep doctors would just keep telling patients, you just need to keep working on the CPAP and tolerating it, and you have to make yourself wear it at night. And it just wasn't working. It just wasn't a possibility. And now I think it's becoming more and more recognized, especially among the sleep physician community, that there are really good, viable alternatives to the CPAP. So as Dr. Giurintano mentioned, like there are good therapies that are out there now, and we would strongly encourage people that can't tolerate the CPAP to explore them.
Okay, thank you very much. Dr. Russo.
I think with a lot of things with sleep, I think one of the things that was always one of my big takeaways is to keep on working at it, that there's often it can be a bit of an incremental improvement as you're working on tolerating the CPAP better, as you're working on getting the voltage up on the Inspire, and things will happen in pieces, but when you look back over the month's time frame, you'll be able to see that difference.
Wonderful. Well, thank you for all the wonderful information. Thank you for joining us. That wraps up our broadcast. We hope our viewers got something out of this. I know I did. So I appreciate all the information. This will be available for replay if you need to go back to listen to anything that we talked about today. Again, share this broadcast with your friends. And if you would like more information or to schedule that appointment with one of our experts, please call 240-898-4418, and we'll put that phone number in the comments. Thank you again, and thank you to our experts. Have a great rest of the day.
Thank you. Bye-bye.